Fatal overdoses from heroin, painkillers, and other opioids have quadrupled in the U.S. since 1999, killing more than 33,000 people in 2015. In the battle against that drug epidemic, the Affordable Care Act has emerged as a first line of defense, offering treatment services that can save addicts' lives. But the new administration and the new Congress have promised to repeal Obamacare. And that could have devastating effects in places like Louisville, Kentucky, where overdose deaths recently surged by 31% in a single year. Dexter Thomas reports.
After almost 5 months behind bars, Rhonda Harden is being released from Louisville's main jail. Rhonda was arrested back in July for shoplifting to support her heroin addiction. Today, she's leaving pretty much the same way she arrived, in the back of a patrol car.
I've been doing drugs since I've been 11. It's a struggle every day. It still is to this day. I struggle with being clean.
Rhonda's eligible to receive free drug treatment because the jail enrolled her in Medicaid, which Kentucky expanded through the Affordable Care Act. A guard is taking her to get a shot of Vivitrol, a drug that blocks her body's cravings for heroin and other opioids.
I'm going to take a seat right here. I'm just going to go over some things. Vivitrol is a medication that's a shot that's given every 30 days that blocks the receptors. It's similar to a manhole cover over a hole so that the opiates, even if they tried to get in, they could not attach to that site. So even if you used opiates, you're not going to be able to feel the effects of it. Any questions?
No.
Okay.
So you're at the jail and somebody takes you aside and says, okay, if you're serious about getting better, we can sign you up for health insurance and that'll help you.
Yes.
What was going through your mind when they were telling you that?
Somebody cares, and thank God that there's something out there that'll help me pay for this. But if I was released from jail, straight from jail on my own, I probably would go get high because it's easier to get $20, $40 than it is $1,000.
Kentucky was one of 31 states to opt into the Affordable Care Act's expansion of Medicaid. About 450,000 of the state's poorest residents enrolled, and treatment services for substance abuse for those beneficiaries has increased by 740%. The Louisville jail staff has used the program to combat one of the state's biggest public health crises. Yeah, how many of y'all are dealing with opiate addiction? That's pretty much everybody.
The only way that I stopped using is if somebody stops me, like my judge. She put me in here, and I was really mad at first, but now I thank her for that because I was wanting to die.
Beyond enrolling inmates like Rhonda in drug treatment through Medicaid when they're released, the jail also has a program that offers counseling while they're still incarcerated.
Everyone that comes in, everybody that comes in, we processed 32,000 people last year. We're asking them, do you have health insurance? Do you want health insurance?
Before you had this program, what happened?
Well, we were doing what was traditionally done in a detention facility, is you open the door and you say goodbye. We are making strong efforts to get them enrolled in healthcare insurance because we know healthcare is the driver of a lot of bad behavior. If you don't feel good and you're not capable of going to work, not capable of taking care of yourself, and you still have to survive, then you're going to get involved in behavior that's not healthy. You're going to steal from people, you're going to use drugs to mask your symptoms, you're going to end up being arrested. So that's where Medicaid has come in.
While the Affordable Care Act has support in Louisville, Republicans like Kentucky Governor Matt Bevin and Representative Tom Price, Donald Trump's pick for health secretary, say it's too costly. Price favors a different approach to addressing the opioid crisis. He introduced a bill in 2015 that proposed repealing Obamacare and replacing it with a plan that would give states $750 million worth of grants to spend on combating substance abuse. Critics like Democratic Congressman John Yarmuth say Price's plan would mean that insurers are no longer required to cover drug treatment, potentially ending programs like the one at the Louisville jail. The Medicaid expansion here has been used a lot as sort of a success story. Why are we now in the position of talking about it possibly going away?
You have to connect the dots to what a repeal of the Affordable Care Act would mean, because it means an end to the guarantee of coverage for substance abuse and addiction. And if you repeal the Affordable Care Act, that guarantee goes away. And we're talking literally thousands and thousands of people who are being treated for their addiction who will lose coverage. And they'll be either have to come up with the money themselves, which in most cases is impossible, or they're going to spiral into more serious problems. So you're going to have a human cost.
Human cost meaning death.
Human cost meaning death.
Both Price and Devin declined our interview requests. Kentucky was projected to save $21 million on mental and behavioral health in 2015, thanks to the Medicaid expansion. In Rhonda's case, each shot of Vivitrol she'll receive costs over $1,000. She says she could never afford it without Medicaid.
Me going to jail, I actually saved my life. Heroin it's an epidemic right now, and it's killing people.
Turn that way.
This is actually a life-changing shot, you know, if somebody wants to really get clean.
And you really wanted to take this shot?
Yes,
Why is that?
because I'm ready to change my life. I'm ready to get clean. I'm 40 years old almost and tired of using drugs. I think I can deal with one shot a month compared to sticking a needle in my arm every day.